We have a really fun topic today, resilience in rehab. I think this is going to be a talk that we all learn something from and have some real good practical takeaways. So it's my pleasure to introduce Mike DeMille, who is a physical therapist at Pure Performance, and he has his doctorate in physical therapy and also an advanced certification in the Postural Restoration Institute, which makes him extremely well qualified to be giving us advice on moving and exercising in a safe way. So I think it will be a really fun discussion. So welcome, Mike. We can't wait to hear what you have to tell us. And just a reminder to everybody, please, we'll do a Q&A after Mike's lecture. So please type in those questions and we'll be ready to facilitate hopefully a fun discussion. So welcome, Mike.
Awesome. Thank you so much. I'm gonna go ahead and share my screen here. Perhaps. Here we go. Yeah, there we go. Like Dr. Hedgepeth said, this is a topic that gets me super excited because we're talking about health through resilience, which isn't necessarily something that we would always pair together. It can often be a discussion that is very separate from itself. It can oftentimes be a discussion that we wouldn't necessarily think about doing things like training with weights, training our endurance system in a way that requires a lot of intensity. And it's not necessarily a discussion where we would think about the word resilience. And I'm going to talk today about why that's exactly how we have to be thinking about this. So I'm so grateful for the opportunity to present to this group. It really is my passion to talk about physical therapy and to talk about wellness. And I'm honored because I know that this group is actively choosing to take an interest in their health, with their attention, by joining this group, with their time. It's really, I get very grateful when I can talk to a group that I know is already asking the right questions and seeking out the information. So if you're the type of person that is coming on a webinar on Wednesday at 3 p.m. to learn about me, talk about physical therapy and exercise and things that I'm passionate about, then you're the type of person that I like to give this talk to. So thank you for being here. So just a little introduction to this conversation and why this is important. I think it goes without saying that this is a conversation that absolutely needs to be had. Unfortunately, in our culture today, we certainly have a lack of exercise problem. It goes without saying that we have an obesity problem. It goes without saying that we have a cardiovascular health and cardiovascular risk problem. It's something that we've known about for a long period of time. And the part to me that is really fascinating as someone who has studied this and has gone to undergraduate and graduate school to learn more about this is that we don't have a lack of information problem in this country. We really don't. And usually when I give this talk and I'm in person, everyone's sitting in front of me and I say, who in the group has tried an exercise program in the last month? And usually when I say that, about 90, sometimes 100% of the hands have gone up. Everyone's trying a new program. And then I ask the follow-up question of who has been able to stick with that same program, the same amount of days, the same amount of sets and reps, who's been able to stick to that program meticulously without problems for that entire month. And then kind of sheepishly, 80% of those original 90% of the hands go down. So the question is, why are we having such a difficult time picking a routine and then sticking to it? And the conversations that I have with people every day, people that are injured, people that are in pain, is what are the barriers to making that happen? And there's definitely some common barriers, like, hey, Mike, I really just don't have enough time. I have a busy schedule. I work long hours. I go into the office early and I just can't fit it into my schedule. And that's one that I totally understand. Definitely a problem. Definitely something that could be figured out. Another one of those problems is I'm just not motivated. Every time I try something, it doesn't work. It's not fun for me. It doesn't feel good, whatever it is. So lack of motivation is a second problem. But the third problem is the one that I deal with every single day. And that problem is every time that I go to exercise, I get hurt. I get injured. I stick with the plan. I start running a half a mile every morning. I do it as my New Year's resolution. The New Year's resolutions are very popular right now, but I can't exercise in a way that's going to help me reach my goals because I'm going to get hurt before I get to the goal. And if that sounds like you, we are totally speaking the same language. I work every day with people that want to run the marathon. They want to go skiing. They want to play golf on the weekends. They want to be able to walk down the street. They want to be able to pick up their grandkids. Whatever problem that it is, my mission and our mission here is to take away and understand this barrier of pain and injury. It is my goal for you that with all of these things that make exercising and staying healthy really, really difficult to begin with, I don't want this barrier of I'm going to get hurt while I'm doing it to be a barrier that any of you have. Because as we're going to learn through this, there really is no reason to have that as a barrier. There's things that we know with the most advanced practices in science. A lot of them are not all that complicated, fortunately. They're very simple solutions. There's no magic secrets that I'm going to be able to present to you today. I wish there was. That would make things way more fun and way more interesting. But the truth is these solutions have been around forever. And we just have to find out and understand, why does pain and why does this old injury and why does my osteoarthritis and why does my back disc degeneration, how come that's limiting my ability to do these things that I want? And is there another solution around that? So that's really my mission, is to help you understand that. So just a little bit about me and about our practice. Everyone here that is going to be guiding someone through an exercise program, if you want to be able to do it in a way that's pain-free, you have to understand the movement. You have to be an expert of the movement. You have to be able to observe. You have to be able to analyze. You have to be able to correct. You have to really be able to diagnose, treat, watch, and I'm going to give you some examples of this later, exactly what the movement looks like. So like I was saying before, if the problem that you're finding out that you have is that the barrier that's in the way to your exercise program being successful is your fear of getting injured, then that's really what I want to be able to help you with. That's really what we're trying to do here, because that fear of injury and that fear of pain to do things that you otherwise would think would be a huge problem, that's the thing that doesn't need to exist. Kind of like I mentioned above, this is not the type of place, this is not the type of facility, and it wouldn't do justice to the problems that you have to come up with a cookie cutter, one size fits all program. I've been having a lot of patients recently that are riding these Peloton bikes and having, an existing knee injury flare up, and having an existing hip tightness issue flare up, or lower back pain. And it's something like that. That's a perfect example of, I don't want these minor aches and pains to turn into big aches and pains and then to keep you out of the game. And along with that, we're going to talk about some very common conditions that you probably experience. And if you don't experience, you probably know someone that has. And then what the heck to do about that? So the first two things that come to mind are knee replacements and hip replacements. If you're in that zone right now, and this is the majority of my clients of, I'm 50, 60, 70 years old, I would love to be able to exercise, but it's my understanding that the more I pound on my arthritic knee, it's going to continue to degrade and degrade and degrade. So I have to lay off my knee. I don't want it to get swollen. I don't want it to get painful. I want to last as long as I can before I have this joint replacement, because then I'm really going to be doing this long recovery process, and I don't want to go through that. And I've heard it so difficult, and I've heard it so painful. If you're one of these people that has a problem like that, that is the type of thing that we need answers to. And just to give you a spoiler alert, the solution to treating osteoarthritis specifically, which is something that I see a lot here, is that you have to end up putting more weight and more load through the joint. And I'll let that sink in for a second. I'm saying to help your arthritis, we need to tell your body that it makes the most sense to have cushion and to have cartilage and to have bone density, keeping that cartilage afloat and keeping that joint healthy. That comes from weight bearing. It's not a scenario where the more you bear weight on it, you're chipping away and chipping away bone until you have none left. Fortunately, that is not how it works. That's the good news of this talk, is the things that we've been told about, I have to take rest and I have to lay off and I have to be careful and I can't exercise. A lot of that simply isn't true. And that's great news, because if it were true, it would mean, we're all screwed. But the truth is that fortunately we're not. And we're going to talk about exactly how that works. So I want to restore some faith in you that movement and exercise is probably more intense than you otherwise would have expected, when observed and coached correctly and completely into your exact unique situation, that exercise and loading the arthritic joint, for example, is the solution. We don't have to think about injections or joint replacements or cortisone shots or whatever it is. We don't have to think about those, because the answer's been right in front of us the whole time. And that's really what gets me excited about this talk. So after today, the things that I want you to be able to understand are, what is the actual truth about pain and injury? Because these come from somewhere. It's not like they're coming out of nowhere. It's something that we're starting to understand more and more as a scientific community. And it's something that you deserve to have the information and the secrets and the keys to. So what is the truth about pain and injury? Exactly how do these things work? What can I do when I'm in this scenario? Are there options for me? So that's the first thing that I want us to be able to understand. The second thing that I want us to understand are, what are these secrets? What is the information that we don't have? Where in this country, there's more and more knee and hip replacements and lumbar degeneration and discectomies, which we're going to talk about, and rotator cuff tears is a big one. What is the secret behind these nagging injuries that don't seem to go away, that's preventing us from doing the things that we love? And how do we get there? That's what today's talk is going to be about. How do we get there? So the last thing that I want you to understand after this talk is, what is your biggest limiting factor holding you back right now? And not to mention, a lot of these issues start to coalesce with each other. So for example, let's say you're the person that's trying to avoid the knee replacement. So you say, all right, I have to take it easy on my knees. I can't do this walk that I used to do. I can't do this hike that I used to do. But at the same time, my body weight, me being overweight or whatever the scenario is, the more weight that I put on, we know that there's going to be more and more stress on these joints. And then this becomes a vicious cycle, because the more stress that's on my joints, I'm going to be less and less active. And the less and less active I am, the harder it's going to be to keep my endurance up and to keep myself in shape. So the biggest ammunition that we have against this problem is to figure out, how can we break the cycle of having to rest and having to take time off and not being able to get these things done, that is feeding into both being in shape and then feeding into these orthopedic injuries. So, if you see someone walking around and you say to yourself, oh, well, that man or that woman, that person looks 10 years younger than they are. Well, I promise you, for whatever reason, they're the type of person that is able to keep this New Year's resolution. So today's February 3rd, they're able to keep this New Year's resolution in October. And they haven't stopped anywhere along the way. And they haven't had any blips on the radar that has made them rest along the way. And if you can do that, all of these problems that you might have are completely controlled to the best of your ability. But to get there, you have to be able to get out of pain first and to reintroduce safe, healthy movement to get you out of pain. And that's really where seeing a physical therapist that understands how to get you out of pain and then to load your joints and load your body successfully can come into play. So we've talked about this a little bit so far, but if this sounds like you, if these points right here sound like you, then you're in the right place. Usually when people get to me, they've seen multiple personal trainers and it hasn't worked because the personal trainer doesn't understand how their body works. And you might have one of these bodies. They've been to multiple physical therapists, and I love physical therapists. I'm a physical therapist, but sometimes it just isn't the right approach for you. And then you might go to someone else like an acupuncturist. You say to yourself, okay, I need to go a little bit outside of traditional medicine because I need to see, someone that has a different approach because the trainer didn't work, the therapist didn't work, my back still hurts, and I really want to stop this. And then you see the acupuncturist, and then that might not work. So you might see someone like a chiropractor. You might see someone like a functional medicine doctor. You might see someone like a massage therapist. You might see all of these people, and you're running into the same problem. The same thing goes, and this isn't necessarily a nutrition talk, but the same thing goes for diets. I see people that go from the low carbohydrate diet and the high carbohydrate diet, and the high fat diet and the intermittent fasting and the eating small frequent meals, whatever it is. The same thing happens to us in the physical therapy industry. And again, the news is good. That doesn't mean that, there's all of these different exercise protocols, there's all of these different diets, and that must mean that we don't have the answers to this question. It's actually the opposite. The fact that there's so much information out there, the ones that continually rise to the top and help people get better have common themes among them. They're all working for basically the same reason. When you boil it down to simplicity, the last thing I want to do is make this complicated for you. You could go on Google and Google, I need to do an exercise program to help me with my lower back pain. And you'd probably get like 10,000, a million, however many results. A goal of my talk here is to limit the amount of Google searches that my prospective clients have to do. Leave it to the professionals to sort through all of this complicated information and let me give you the simple truth of how these things work. And that's something that we're going to talk about. Let's make this simple. It's complicated enough. And then a lot of my clients are in a situation where they're not trying to go back to being, an Olympic weightlifting star or a bodybuilder or some sort of macho person. Lifting weights is not about being a big macho person. I've seen clients all the way from 8 years old to 88 years old and everywhere in between. I've seen people that are elite level Major League Baseball athletes, and I've seen people with fibromyalgia that haven't left their bed in 2 weeks. And again, I know I'm beating a dead horse at this point, but the themes that get those two people better, so a Major League Baseball player that's going to go compete on the field, and someone who's 88 years old who can't get to their mailbox and back without having lower back pain, of course, the problems and the program to solve those problems are going to be completely different. But the themes and the mechanisms of how those programs work are completely the same. So if you're saying to yourself, Mike, I just want to be able to play with my grandkids. I just want to be able to pick them up without throwing my back out. Or Mike, I just want to be able to play golf with my buddies on the weekend without having to take a Tylenol before and after, because I'm really worried about the long-term effects of some of these things that I'm doing. If you just want to go back to living a normal, happy, healthy life, then that's where some of the solutions that we're talking about today can come into play. So along with that, if you're doubting that exercise is even right for you at this point, that is who this talk is for. Because exercise in any way, shape, or form, however it needs to fit the unique injuries that you have. I've seen POTS patients. I've seen folks with Parkinson's. I've seen folks with fibromyalgia, like I mentioned before, emphysema, COPD, whatever it is. We're all bringing something different to the table, and that has to be assessed, and an appropriate recommendation has to be given. But we should all be able to engage in these programs that make our lives better. So along with that, I'll tell you about someone that fits those categories that we just talked about. And it's a patient of mine that I still see now on a regular basis for some maintenance physical therapy. And I was, talking to her this morning, and I told her to say, hey, you're going to be in the talk. And she was really excited about that. So this is a real patient of mine. She's 62 years old. And when she got to me, she was in 20 years of chronic pain. I'm talking about rotator cuff tears. I'm talking about knee arthritis. I'm talking about L4, L5 disc degeneration, which is something you might have heard before. I'm talking about low back sprains. I'm talking about wrist injuries, whatever, you name it. And this is a person that had been to physical therapy, that had been to pain clinics and gone down that road of trying different medications, which certainly helped. And she had been to chiropractors as well. So had been to a bunch of different practitioners, continued to have these kind of nagging behind the scenes problems. Her goals were no more complicated than she wanted to stay active and to play with her grandkids. And at the same time, which I think kind of relevant to specifically this talk, she wanted to be fit enough to control cardiovascular risk factors as she got older. And I'll tell you what, if your knee hurts and it's limiting you from riding an exercise bike or being able to walk, then how on earth are you going to be able to get your heart pumping fast enough where it can do some good, healthy, endurance-based cardiovascular work for you? And that's really the problem. How do you break that cycle of getting back to these things in a simplistic way? And not only when she was seeing these practitioners was it frustrating because none of them were necessarily solving the problem, but on top of that, like we talked about in the previous slide, all of these practitioners were saying something different. One's telling me I should stretch. One's telling me to avoid stretching. One's telling me I'm too stable and too rigid. One's telling me I have unstable joints. One's telling me I have to put heat on my lower back. One's telling me I have to put ice on my lower back. All of these things that we feel like are important, we have to boil down the truth of what's really important. So I want you to give yourself a mental picture of who this person is and what they look like. And let me show you what they're doing today. So at this point, her lower back pain is managed and she's not having a problem with it. All of these knee, hip, and shoulder issues are fine. And this is what she's doing. This is her physical therapy routine. This is her physical therapy routine. Again, this is a 62-year-old woman with knee osteoarthritis and lumbar spine disc degeneration. And that's a 50-pound kettlebell. And she was able to lift that, 8 times? And let me tell you, I'm going to play it again because I'm so proud of the progress that she's made. This is literally perfect form. And this is not someone who necessarily came to me and was an athlete or a former athlete. This was a regular old person off the street that had some of these issues that we can all get as we age. And as I'm watching her and as I'm watching the form of that exercise, this is putting her in the opposite direction of having a lower back problem. That is literally making that lower back, that lumbar spine healthier and stronger. And I think when we look at these exercises and make assumptions about what we know about them, we would say, Mike, that heavy weight is going to hurt me. I can't do that. I have whatever this problem is. I have fibromyalgia. I can't do that. I have POTS. I can't do that. This is going to be a problem. And I'm here to tell you that we've seen the most complex issues come in. And when you first start, you need that really individualized approach to get you back to baseline. But the ultimate goal for most people is going to look pretty similar. We need to be able to get your muscles strong. We need to be able to give you some endurance. We need to be able to get you flexible. We need to be able to do all these things on a consistent basis. So needless to say, she's excited for her grandkids to come now because she could pick them up, She's excited to get back to the golf course because she knows it's not going to hurt her back the next day. She comes into PT and checks in on a regular basis, but she's doing this program on her own at home. Now, it didn't start with lifting a 50-pound kettlebell. Certainly didn't. It started with lifting a 10-pound kettlebell. And then the next week, it was a 20-pound kettlebell. And before you know it, if you're New Year's resolution still an October person, all of a sudden, before you know it, you can lift as heavy as you want. And someone that can lift a 50-pound kettlebell, their world opens up. You know, she can do so many different things that involve her lower back now because she knows that she can do that. And her body knows and is built in a way that knows that she can do that. So she has more options of things that she can do now. She doesn't have to worry about her lower back getting hurt in some vulnerable positions because she knows that she can do it, and her body and her brain know that she can do it. And she's built it up in a way that's smart enough where she didn't get hurt doing it along the way. And then the second case study. And this one I think is even cooler. And I'm going to talk a little bit before I play the video. This is a 65-year-old gentleman, so even a little older. Same scenario, not necessarily a lifelong athlete, but came to me because he had a problem. And his problem was an L4, L5 discectomy surgery, to which he said, you know, Don, you're going to have to be careful lifting anything over, I don't know what he was told or what he found out. Let's call it 30 pounds, because we're worried about the integrity and the health of this lower back. Well, let me tell you, he is literally, and again, this is his physical therapy at this point. He's deadlifting over 200 pounds. That's a 65-year-old man with lumbar disc degeneration. And look at his form. It's absolutely perfect. And let me tell you what, when you get to this level and when you get to the level in the previous slide, not only are you doing something that's orthopedically healthy for your joints, this is a cardiovascular workout. This is an endurance-based workout. This is a strength workout. This is a flexibility workout. When you can start to do these higher level moves, you're hitting everything at once. And we can organize it and be very smart with it in a way where your PT is your strength training. And you can do both. And there really is no difference, you know, no magic stretches with a band, you know, no special core exercises, even though we have done that to get him to where he is. This is a gentleman who's loading his spine in a way that's going to make his spine healthier. And when you take the time to be consistent with it, when you take the time to learn exactly how it works, when you're in a scenario where you have a physical therapist that you trust, and even when you do things that, you know, might make you a little anxious before you do them, you say, okay, I know that this is the path that's going to open up my world. That's when you really start to experience some significant results. So what you're probably thinking at this point is, okay, Mike, that all sounds well and good. You know, that sounds fantastic. I certainly want to do that. But how the heck do we do it? You know, how the heck do we get there? And what I like to say to my clients is the secret is in the circle. So let me talk to you a little bit about this circle. When I explain it and offer the visualization exercise to my clients, you can think of the bandwidth of what you can handle like a circle. So if your circle is this big and everything that exists inside the circle is balance. You might have heard of the word homeostasis before. You know, we have one for our body temperature. If my body temperature is in a certain range, if it's inside a certain range, then I'm healthy, then I'm good, then I'm not having problems. But I'll tell you what, the second you are encountering a stress that is outside of your circle, outside of your boundaries of homeostasis, that's when you get injured. And that's when people usually come and see me. So you have your circle, you have an event that kicks you outside the circle, and all of a sudden you have a problem. So the first thing that the clients that see me that are actively in pain have to do is we have to get you back inside the circle. And that is the part of the process that is the most individual to you. Dr. Hedgepeth mentioned that I have this certification through an institute called the Postural Restoration Institute, where we're doing specific breathing techniques and doing specific autonomic nervous system regulation techniques, which you might have heard about before. And that is all in an effort to get you back inside of your circle of homeostasis. That is the first thing that you need to do, because you can't start to build any resilience if you're experiencing a lot of pain. You just can't do it. But I would be doing the process an injustice, even if I said that getting out of pain and getting back into your homeostasis, I don't even think it would be fair to say that that's 50% of the process, getting out of pain. Because honestly, I think it's 10% of the process of getting out of pain. The part where we go wrong as a healthcare industry is we're trying to figure out and diagnose and solve the symptoms, but we haven't addressed the cause at all. So here's the part that I think is the most important of the whole talk. If you get this, then you understand what we're talking about. In order to avoid an injury in the future, I have to take my homeostasis, I have to take my circle and increase the size of it. I have to make my circle bigger. Because you know what happens when you can make your circle bigger is something that was out here that used to bother you, that was just beyond the edge. If it's now inside of my bigger circle, I'm not going to get hurt or injured from that same stimulus anymore. It's not going to bother me. My body is strong enough and resilient enough where it can now take a more difficult thing than it could last week. So to give you the example, I showed you the clip of that woman deadlifting 50 pounds. Well, we started at 15 pounds. And she said, you know what, Mike, I can't do it. I feel like I'm going to get hurt. My back is already sore just thinking about it. I don't want to do this. I said, you know what? You don't have to do 15 pounds today. That's okay. But what you have to do today is you have to do 12 pounds. All you have to do is 12 pounds and do it as many times as you can. And then we'll go from there. She did 12 pounds. She said, Mike, it was terrifying. I needed you to watch me every second. I needed to know my form was perfect. I might have felt a little twinge, but it was fine. And I actually feel okay now. I'm tired, but I feel okay. And then we did that a couple times. And then when we came back the next week, it was 12 pounds again. But she said, you know what? It wasn't that hard this time. Maybe I could try the 15. And then we did the 15. And then that process repeated again and again and again until we got to 50. But here's the key, because there's a fine line between doing something that you feel comfortable with and doing something that's going to be the best for you. Because when you get right to your borderline of what's comfortable, let's call it 15 pounds, that is an activity that's at the edge of the circle. So to further the point, if you do something that feels too easy, that might feel good, that doesn't feel a little scary, it's not going to be a big enough stimulus to make your circle bigger. Think about that for a second. You have to go to your edge of what your body can handle to make yourself more resilient. You might have to do an activity that you don't feel 100% comfortable with, but you're trusting a coach to tell you that it's the best thing for you, or there's no way that your circle has an opportunity to get any bigger. And that is where we go wrong. If we do 5-pound deadlifts every week, then you can only handle 5-pound deadlifts. We have to push it. And that's where the skill of the practitioner comes into play and understanding your unique situation. We have to push it to the very edge of what you can handle, because that's when you can start making these improvements and these gains where your world opens up. And that's when you get to the point where you come in deadlifting 5 pounds, 15 pounds. And when you've kept your New Year's resolution in October, you're deadlifting 200 pounds. Everyone goes through that process. There's a way for everyone to get there, but you have to be able to live life on the edges of this circle to be able to experience that. And all of this is to say, and we've talked about this point multiple times, but this works well only if you actually do it. You could be totally on board with what Mike is saying in this talk right now. You could say, Mike, I totally get it. Resilience is the key. I'm going to push myself to the edges of the circle. But if you don't actually do that on a consistent basis, and for weight training, we're honestly talking about 3 times a week of activity that's on the edge of your circle, truly on the edge of your circle. Think about it. Not where you gave yourself a break and you said, that's enough, truly on the edge of your circle. That's when you start to make these gains that can change your life. And I've seen it happen time and time again, which is why I'm so happy to share those 2 case studies. Like I told you, I've seen it happen in people with chronic pain. I've seen it happen with people with POTS. I've seen it happen in people with fibromyalgia. I've seen it happen with people with complex regional pain syndrome. If you've heard of that one. All these different diagnoses. If we know how to get you back inside your circle to start, and then appropriately with perfect precision, identify exactly what that activity is on the edge of your circle, then that's when we can start to make gains. And that is an activity that's for everyone, but you have to do it and you have to stick with it. You have to be Mr. or Mrs. New Year's resolution in October. That has to be who you are. And then when you get over your pain and your circle starts to get bigger and you say, hey, I like the way this feels. There's nothing that says, whether you're 20 years old or whether you're 80 years old, that you can make your circle as big as you've ever wanted to make it. And that's where someone like that second case study, I'm sure his lower back pain could have gotten better if he chose to stop deadlifting at 100 pounds. But why not have your back pain go away, feel amazing, and be able to do things that you haven't been able to do before? Because the same things that got you out of pain in the first place are the things that keep it going. And it's not even a scenario where the heavier you lift is riskier. Hopefully you can be able to tell by this point that the heavier you lift, the safer you are. And that is like a complete, we haven't even thought about it this way. Physical therapy hasn't thought about it this way. This is a relatively new idea. The heavier you're lifting, if you do it in the safe and progressive manner, the safer you are, the more options you have, the less likely you are to accumulate and develop further osteoarthritis. That is the key. When you can do these activities and do them forever, that is when you truly mitigate your risk factors. Wow, that was fun. That was a lot. As you can tell, I love talking about this stuff because I think we don't usually think about it this way. We don't think about health through the resilience pathway. Think about health through the recovery pathway or the disease pathway, or the unhealthy pathway. We don't think about it through the resiliency pathway. So if any of this information resonated with you, and I really hope it did, if some of those points made you feel like, this is something that I should consider, then you have an opportunity to schedule a free, 15, 30-minute strategy call with me, because I want to hear about all these unique scenarios. I want to hear about the history of your POTS and why it's been challenging for you to have an exercise program work for you, or your fibromyalgia, or your arthritis, or your rotator cuff tear, whatever it is. I want to hear about this specific scenario and exactly how it works. So this link is going to be available for you. It's to my personal cell phone. And that's how we can get this process going. Talk to me, I'll figure out if there's a plan that could work for you. And that's how we can get started. Cool.
Well, thank you, Mike. That was great. So fun. And I think your enthusiasm is really contagious. So thank you for that. I think, most of our patients know how committed we are at Lown to exercise and how we really believe it is the fundamentals, to treat most chronic diseases. So clearly you are on the same page as we are. So thank you for that. Maybe to just kind of start off this discussion, we should just talk about your practical approach to somebody that reaches out to you with back pain. Sure. What are the types of questions like you're asking? And then what do you do with your assessment to kind of build this personalized program?
Sure. So something that often comes up is, how is range of motion and flexibility related to lower back pain that I might have? So just to dive into something specifically, a lot of what I work with is the position of the rib cage and the position of the pelvis. So when it comes to something like lower back pain, we essentially need to be able to position ourselves, and this is why I put those videos in there, in a scenario where your rib cage is stacked right on top of your pelvis. So that would mean not an excessive anterior tilt of the pelvis and not an excessive rounding of the pelvis. So if you saw those videos of the people deadlifting, they started with exercises that were easy. They were lying on their back, their feet were up on a wall, they were in an all fours position, and we were helping train that ability of the core muscles to work, the ability of the rib cage to be in the correct position. And then we started to load more on top of it. Because just like I talked about at the end, if I started with the deadlift day one and said, all right, this is going to work for your back pain, they're going to immediately go outside of their circle. They're going to go outside of their circle. So we have to start to teach the appropriate position in, very fundamental, somewhat easy positions, get the core to fire in a way that we want to, get the hamstrings to fire in a way that we want to, make sure that we're keeping that position. And then it applies to all different exercises. So it could be a push-up, it could be a deadlift, it could be a plank, whatever it is. And that's how you start to build that capacity. And then you can go to more and more moves.
So that's a great way, I think, for us to kind of conceptualize what you do. And as we're kind of in this virtual world right now, where people really want to be, safe and protected, but also have this personal assessment. How do you think, can you do this over Zoom? Or how do you kind of figure this out for patients that really aren't ready to be back in the gym yet, or maybe really shouldn't be in a gym yet?
Yeah, so, I have been able to do this successfully over Zoom, and it has a lot to do with the specifics of the cueing of the exercise. So a lot of times what I'm doing to start off, kind of similar to like people might have experienced at a yoga studio, is we need to be able to be back in touch with our bodies. So I call it, sensory awareness, or like sensory landmarks that people need to be able to fit. So, you're lying on your back. I'm asking you to tilt your pelvis. I'm asking you to take a full exhale, and I'm going to ask what you feel as you do that. So that's a motor sensory competency. Do you feel your hamstrings when you tilt your pelvis? Do you feel your abs when you go into a plank position? And I can watch over video and get the feedback of, Mike, when I do that move, I feel my lower back. Or when I do that move, I feel tension pick up in my neck. Whatever it is. I can't feel my hamstrings at all. And now that you mention it, I've never felt my hamstrings. Well, that can put us down a path of, okay, I know what this person needs. I know what exercises they need to get back in touch with the sensory part of their body. And then we can build it that way. And like I was saying, you start with the simple positions, you make sure that it's happening correctly, and then you build off of that.
Awesome. I think, so much of that personalized approach, right, is similar to, I think, what we see in the office, right? We can't just make a blanket statement. We really have to see what the specific problem is, right, to have kind of that personalized intervention. And now that I've said that, I'm still putting you on the spot to make these general statements, but some of the questions are really related to specific back pain and maybe a diagnosis of scoliosis. Any thoughts about how you approach back pain or injuries or having curvature of your spine in different ways when you're assessing a patient?
Yeah, let's talk about scoliosis, because I love that question. And it relates specifically to what we have talked about before with the certification that I have with the Postural Restoration Institute. And when you think about the back and you think about the diaphragm, we are all built asymmetrically. Folks that have scoliosis, folks that don't have scoliosis, folks that have different injuries that might be unrelated, we're all built asymmetrically. And we're built asymmetrically because we have a heart on one side of our body, we have a liver on the other side of our body. Because those two organs are positioned the way that they are, the diaphragm has to dome over the liver that's on the right, and it has to stay flat underneath the heart on the left. So when that happens, every human being, and I think something that people don't typically realize when I talk about this, is right-handers and left-handers have a tendency to overuse their right diaphragm as a postural stability muscle. And we overuse it because its attachment sites are literally twice as thick as the left side, because we've got the organs placed where they are. So what this looks like in the clinic is a loss of internal rotation on the right shoulder, a loss of hip internal rotation on the left shoulder, a straight leg raise that's limited on the left. There's these predictable signs in people, and scoliosis is an extreme example of the inability to compensate and deal with the asymmetry of this diaphragm. And that asymmetry goes all the way up to the brain as well, and the cortices on the right and left side of the body. So, and this all goes back to, that is my best strategy to get people back inside their circle. We have to take into account all of these things that exist in the body, and they're going to be a little bit different in everyone. But that one, for example, with the scoliosis, is we have this asymmetrical tendency to start with. So people that do exercises with me are oftentimes just doing them on one side, and they're only asked to feel a muscle working on one side. And that has to do with restoring as much symmetry as possible in order to be able to do the activities that you want to do. And I'll go just a little step further with it. So if we are asymmetrical, we'll lose the ability to rotate. So with low back pain specifically, if I'm in a scenario where I've had lower back pain before, I'm going to have to stiffen up because it's the only way I can combat and keep myself stable with this asymmetry. And then I'm going to lose the ability for my rib cage to rotate right and left. When I do that, now the muscles on my lower back aren't getting a chance to shorten themselves and then re-lengthen themselves. So the thing that you have to do to start with that is get the rib cage back in a good position. Get your whole body in a position where it can now rotate again. And then when you can rotate again, that's when you would start to apply some load to these positions so that you can go back through your gait pattern, you're walking normally. So that if you're doing an activity like golf, you can rotate your rib cage from side to side. So that when you're loading your joints, you're doing it in a congruous way. I wrote a blog maybe about a year ago about how this approach of alignment and asymmetry relates to osteoarthritis. And maybe it's something that could be useful for you guys, for me to share, but it has to do with creating alignment of the skeleton. And as you're loading joints, you're doing it evenly. And then once you've had that figured out, the discussion that we just had is the way to go. And that's when it comes down to having someone that you're working with that you can make sure knows that with the unique diagnosis they have, the unique situation that you have, that you're going to be doing things in a way that's not putting you into a more asymmetrical position or a more misaligned position or whatever it is.
So that was just such a lovely explanation about how one thing builds on another. And you go from feeling like, oh, 5 years ago, I can do everything to now I feel limited. So, I think, thank you for connecting those dots. And since we can't stop that aging train, I think this is something important to everybody because at some point, the way we move and the way we don't move really affects our whole quality of life. Dara, I see you nodding, so I know you're waiting to jump in on the discussion.
No, but so relevant to that, there's a couple questions in the chat about how can we do the things we need to do just to get through the day more effectively? For example, getting up off the floor or walking up the stairs. These things seem to get more difficult as we get older. So do you specifically have any suggestions for walking upstairs, especially carrying groceries? And 2 would be getting up off the floor once you're down there with your dog or your grandkids.
Okay, so yes, I love that question. And they're both going to have somewhat of a similar answer. So kind of like I talked about before, we're going to work from inside to out to help solve these problems. So what I basically just described is the inside of you has a bunch of different levers that are pulling up and down and rotating in different dimensions. And it's really hard for that part of us to create enough pressure and stability where it's taking pressure off of the rest of our joints. And that's just a really fancy way of saying that we have to make sure that your core is working for you before you go on stairs or before you pick up groceries. And that's where doing all of these different activities and keeping in mind the position of your rib cage and your pelvis is going to be helpful. So really it's a discussion about, how can you train that internal part of your core so that it's taking pressure off of these distal joints? Because if you're doing these activities and you don't know how to create stability and tension, then you're going to overload, your patella, for example, or you're going to have your forearm flexor start to get fatigued. And that could be built through a number of different exercises.
Okay, great. So it's too much to just explain what those would be, but it would be starting with your core and then the muscles that are involved with going upstairs. Because stairs is really it's carrying a lot of weight up against gravity. And I think we also forget that gravity is a pretty powerful factor in our lives. When we're young, we take that for granted, but the older we get, gravity in many ways plays a bigger role in our lives.
Yeah, I think that's exactly right.
A practical question would, people are asking, do you take insurance? Does insurance cover? Do you need a doctor's prescription to work with you?
Yes, great questions. To answer the first one, in Massachusetts, if you're seeing a physical therapist, you have direct access. So no doctor's prescription necessary. If you want your doctor to write your prescription, I always love to hear what their opinion is. So that part of it is super helpful. And then to answer the second question, I am completely out of network with insurance companies. But one of the reasons that you might want to do the discovery call is I'm able to look up your specific insurance information. Some of them get reimbursed, some of them don't get reimbursed, but I could tell you exactly, hey, you have to meet this $200 deductible, and then your insurance is going to cover 80% of this visit. So I can find out, and you have 60 visits per year. I can find out that exact information just for the logistics of the process to run smooth.
Great. Thank you.
And we'll make sure that we share that with everyone when we send our follow-up email with the survey. So we'll get that.
I just saw a question pop up with Medicare. So there's different ways that you can be participating with Medicare in Massachusetts. Unfortunately, I am non-participating with Medicare. And the sad truth is that the laws that are kind of intertwined with how I would have to be able to bill my other clients with working directly with Medicare, it just makes us logistically unable to do that.
Okay. There's some questions out there just in regard to general fitness levels. So, in Massachusetts in the winter, when there's snow out, what do you usually recommend as a substitution for walking? And then for patients that are doing something else, like using the elliptical or walking, what do you recommend for strength training? So maybe you can just tell us your approach to incorporating both aerobic and strength exercises into a regimen.
Yep. Yeah. So generally speaking, and I saw another question pop up about kind of like the realistic expectation of being able to strength train 3 times a week, which I think is a really good question. And, I think with this approach, you would be able to substitute a lot of volume if you're able to use a lot of intensity. So that's another way of saying I could get a very similar effect if I do 4 sets of 10 on a bench press or a push-up with 10 pounds. But if I do a bench press with 40 pounds, I might only have to do 1 set. So the key there is that from a strength training perspective, the weight has to be difficult enough where, again, you're at the edge of your circle and you're giving your body the information that it has to produce more muscle. Because what's happening right now is you're telling it that this weight is so heavy that it's going to be dangerous unless you do produce muscle. So a way to substitute for the time demands would be with intensity. So what could that look like? Probably about 20 minutes at the bare minimum, 3 times a week. You could do it either right before or after, you hit your prescription on the bike. And that's how you can interweave it in. I would say at the very minimum, to maintain muscle gain that you've made, I've seen people get away with twice a week. And all of this too, when you first start, it's certainly going to be less than that. When you first start, you need the smallest stimulus and you're still going to make improvements. But if you really want to keep those improvements, that's when you have to keep up with it. But to kind of answer the question of like, how am I going to be able to fit this into my routine? If you're doing things correctly, you can substitute intensity for long hours in the gym just by making them heavier.
Yeah. And I think that's where that safety assessment, to kind of know where you're starting from probably is really essential so that nobody hurts themselves trying to do too much on their own. There's a question about pain in your hands and arthritis. Any words of wisdom for us?
Arthritis in the hands itself is a tricky one, especially if we're dealing with something that's rheumatological. It's not necessarily like osteoarthritis, like loading joints. So, if it's like a hands and fingers and toes type of situation, the same rules of loading your joints more don't necessarily apply. Now, just like you have ammunition with your quadricep muscles and your calf muscles and your hamstring muscles, you do have the same ammunition with your hands, because the more muscle that you have and the more muscle that you're able to use, you're getting as much blood flow as you possibly can through those areas. So it's the same type of thing where if you can train them on a regular basis and show your body that it's still important to keep a lot of movement and strength in those areas, then the more you do, the better off you're going to be. And when you're doing activities that aren't painful for you. And that can be everything from squeezing a stress ball at your desk to picking up the trap bar like was in the video. Hands and feet are working in both those contexts.
Great. For Mike, for people who don't have access to a gym or don't have equipment at home, are there particularly core or upper body strengthening exercises they can do at home without equipment?
Yeah, good question. So in terms of body weight, what I really like to do, because it can give you multiple benefits with doing one thing, would be something like a push-up. You know, I'm working my chest muscles, I'm working my ab muscles. I can even work my hamstrings if I'm doing a good pelvis posterior tilt. I often do push-ups with people's heels against a wall, because now you have more reference for more stability, and you can work kind of your glutes and hamstrings that would be responsible for a posterior tilt. You know, things like lying on your back dead bugs, where your arms and legs are going away from each other. The more things that are going away from your center of mass, in this case, your core and your abs, are going to be responsible for keeping position. Because when I move an arm, it's challenging my body to go out of position. I have to use my abs to stop that. Things like body weight squats can be, you know, a really good antidote to that. I can regress squats where if you take your heels and you elevate them on something, it makes that depth of the squat to be way easier. And just like the conversation before, we didn't specifically talk about knee pain, but to help a lot of my clients with knee pain, being able to go into the position of a full passive deep squat isn't going to put more pressure on your patella. It's going to keep your knees in a healthy blood flow position. So you've got push-ups, you've got squats for the lower body, you've got, you know, dead bugs and planks for the abs. So there's definitely things that you could get done that would give you everything that you need there without equipment.
These would be a nice complement to someone who might be doing elliptical or just walking and getting their cardio and their aerobic, but then they could do these kinds of things twice a week minimum, 3 times a week ideally.
I think that's right. And like you said, you know, if we're going to create a muscle protein stimulus, and if we're going to create a bone density stimulus, that's where you need to have the weight bearing piece. That's where you need to have the weight bearing piece.
Okay. Got it. Thank you.
And then if we're doing that, Mike, how often should we switch up the exercises so that we're continuing to push the circle? Just knowing how much, you know, that time management or time restriction, I think really affects all of us. How do you think about that while you're building a program?
It's a good question. There's a loaded answer, so I'll try to keep it concise. But just to answer it, about 4 to 6 times a week. But to give you kind of the deeper answer, that doesn't necessarily have to be the exercises themselves. Because when you choose different sets and rep schemes and get yourself tired in different ways, you're going after a different physiological adaptation. So if I'm doing a 1 rep max on a deadlift, it's a muscular tension adaptation. I'm creating so much tension on my system where that's going to be the means that it's building muscle. If I do a lighter activity, if I'm doing a bodyweight squat, but I do 25 of them, that's going to be a metabolic stress adaptation. That one can be specifically good for people with these arthritis related issues. I'm not doing as heavy of a load, but I'm doing a high amount of reps, creating a lot of heat in the tissue, and that kind of accumulation of byproducts in my muscles that really soar, kind of lactic acid, but not really lactic acid feeling, is another way to build muscle. So there's different ways that you can play around, not only with the moves themselves, but also with the scheme of the sets and reps. But I change those up about every 4 to 6 weeks.
That's awesome. So I think you've given us a lot of take homes to think about. The first being, we should not let pain, right, limit the way that we move. We should really seek to overcome that and find an answer. And then 2, we should really be mindful about setting specific goals if we really want to be improving or changing right where we are, and probably working with a professional to at least set initial goals, right? And then build a program that we can, you know, do indefinitely on our own. So those were my takeaways. So I learned a lot from this. So thank you very much. We will make sure to provide everybody with Mike's contact information. And it sounds like he would really welcome everybody reaching out to him if you are interested in working with him. I can say that I have referred my patients, and I have also seen him as a patient. So I can vouch for how thorough he is and really committed to good science as well. So it's been a treat to have you here, Mike. So thank you.
Thank you.
Thank you. I want to add one quick thing, which thank you so much, Mike. And our next webinar is 2 weeks from yesterday. It's going to be on a Tuesday because we have a special guest, Dr. Paul Sachs, who is a world expert on COVID and vaccines and infectious disease, and he has clinic on Wednesdays. So thanks for today, and we'll see you guys 2 weeks from yesterday for our next.